I'm Dr. Jason Bowlds. Every week I try to bring you videos discussing the treatment of certain disease processes. This week I would like to try to break down the complex subject of breast cancer, a disease which unfortunately has affected most families in one way or the other. In most industrialized nations, such as the United States, breast cancer is the most commonly diagnosed cancer amongst women. And in the United States, breast cancer is the second leading cause of cancer deaths behind lung cancer. But know that breast cancer can affect men also, and breast cancer in men accounts for 1% of the diagnoses of breast cancer in the United States. Over the past several decades, a large amount of funding and research has gone into the field of breast cancer, and while the prevalence remains high, the mortality of this disease has slowly come down over the last few years, secondary to routine screening and better treatments. First, we'll discuss the factors which put you at risk for developing breast cancer. Obviously, being female puts you at a huge disadvantage. 1 in 8 females in the United States will develop breast cancer at some point in their life. But know that other than being female, most women who develop breast cancer had no risk factors prior to developing the disease. Another risk factor for breast cancer is having another member of your family diagnosed with the disease. And depending on that family member's age at diagnosis, this may affect what age you need to start getting screened. Also, if there are multiple members of your family who have been diagnosed with breast cancer, it is possible that there is a genetic cause. And you may want to discuss with your doctor whether genetic testing for genes such as BRCA or BRCA1 or 2 is appropriate for you and your family. Other lesser-known risk factors for breast cancer include an exposure to radiation in the past, obesity, which increases your overall estrogen levels, and moderate to high alcohol intake. Also, women who have never had children or have their first children after the age of 30 years old are at slightly higher risk for breast cancer. We will discuss some of the signs and symptoms of breast cancer, but know that most of the early stage breast cancers have no symptoms whatsoever. And while self-exams are important, the best way to treat this disease is to find it early through the routine use of mammograms. And while the guidelines do change from time to time, the standard recommendation is that women need a mammogram once a year after the age of 40. Signs of breast cancer include a new lump that could be found on exam, as well as a change in the size of the breast, the texture, the shape, or changes in the overlying skin, such as dimpling or inversion of the nipple. Lastly, we will discuss the treatment of breast cancer. Just understand that this is an extremely complex subject, and treatment recommendations are usually individualized based on the patient's age, tumor size, pathology, and lymph node status. Just know that breast cancers are treated best when they are found early and when they can be removed completely with surgical excision. Hence the importance of early detection. Early stage breast cancers can be treated surgically with mastectomy, removal of the breast, or with lumpectomy, which involves surgically removing the tumor with a healthy rim of tissue around it. If you opt for lumpectomy, then this is usually followed by radiation to that breast. Both of these treatments have equal long-term survival rates, but lumpectomy has a slightly higher recurrence of the cancer in that breast. Both of these surgeries are usually combined with lymph node sampling, which usually takes the form of a sentinel node biopsy, which will determine if there is any localized spread of the disease. After surgery, and based on your pathology, it will be determined whether or not you will need chemotherapy as part of your treatment. Chemotherapy is usually recommended for those with lymph node involvement or for premenopausal women with tumors greater than 1 centimeter. More advanced cases of breast cancer will be treated surgically in much the same way. But in certain cases, it may be recommended that you get chemotherapy prior to surgery. This is done in order to shrink the tumor so that your surgeon has a better chance of getting it all out during the initial surgery. In cases of stage 4 disease or metastatic cancer, where the cancer has spread to the lungs or liver, the mainstay of your treatment will likely be chemotherapy. This is usually done with or without the addition of hormonal drug therapy. Following your initial treatment period, it may also be recommended that you stay on hormonal drug therapy such as tamoxifen or Arimidex long term. This is usually based on your hormone receptor status, what is known as your ER/PR status. Most cases of breast cancer that do recur over time usually happen within the first 3 years. And your doctors will likely follow you every 3 to 6 months with routine exams and labs. You will also need a mammogram once a year. The takeaway of this video is that the treatment of breast cancer is a complex subject. There are many factors that go into the decision-making process, and this should be a highly individualized approach for each patient. One that usually involves a surgical oncologist, a medical oncologist, and a radiation oncologist. A patient's treatment regimen will likely be determined based on the patient's age, the size of the tumor, and its pathologic evaluation. In the future, genetic evaluation of the tumor in the patient will play an ever-increasing role as well. I do hope that this video has brought you an increased understanding of this disease process. As always, in the comment section, if there are other topics you would like to learn about, please let us know. Otherwise, I'm Dr. Jason Bowlds, bringing you better health through better education.